So I thought I would just give you, I mean, obviously we all know what winter looks like. We all know what winter looks like in Scotland, and each of our areas will have their own specific challenges. But I thought I'd kind of give you a rundown of what happens for us with winter planning and then winter delivery. And I always feel like winter planning and winter delivery are quite often two separate things. What you plan for and what you end up doing aren't necessarily the same. Um, but just to kind of give us a little bit of some of that background thinking about what we do and what we could do differently. And I'm the first to hold my hands up and say that we haven't nailed this in Shetland. It's still a real challenge to us, and our attention is far too often taken onto that A section, that resilience and emergency comms, when we would be better spending our time on some of the other areas. So for those of you that don't know Shetland, I'm sure most of you have heard of us, but we are an island archipelago, quite a long way north from mainland Scotland. And unlike you guys, our biggest challenges are not necessarily around depth of snow. When we get to the kind of winter emergencies, or anything like storms and gales taking out power lines and things like that, we get a lot of high winds up here. It's normal for Shetland. So what we tend to get are levels of ongoing disruption, particularly with our ferry services. If we get prolonged periods of gales, we then start getting into issues with our inter-island ferries not running, and having to manage communications with communities about what this means for their resilience, what that means for them being able to get to hospital appointments, what they should do in the case of, for example, if we get a 999 call out for police, fire, or ambulance to one of the isles and the ferries aren't running at that point. The communities need to know what the solutions are, and we need to be joined up with our community resilience and our community emergency planning boards to make sure that that all goes smoothly. We also get prolonged periods of disruption for our mainland link. And this can mean, I don't know if any of you have ever seen the photos of the Lerwick Tesco when we're 3 days into a ferry disruption, but it basically means that there's no fruit and veg on the island, and we're all starting to worry about scurvy. Famously in 2012, we had a really prolonged set of gales just before Christmas, and the level of panic about the fact that there were no sprouts in Tesco was unreal. Think kind of back to COVID and that toilet paper panic that everybody got into, but sprouts. And what ended up happening with that was a Hercules plane was chartered to fly the sprouts and other Christmas essentials into Shetland. So it probably looks different in your regions, but we're all kind of dealing with similar challenges in that we're trying to manage the ongoing comms, and then weird things happen and you find yourself sitting there being like, well, sprout rationing was not top of my list of like asking the community to behave. And often the messaging we're doing is asking the community to behave responsibly, asking people to think about whether it's essential for them to do a particular thing or whether they need that level of something so that we can manage demand across the island. I just wanted to talk briefly about the winter of 2022, which was probably the winter that brought some of the gaps in our winter planning most to light. So having said we don't get big issues with sort of snow depth, 2022 we had what can only be described as a sort of freak weather incident where we had a level of wet snow falling, but the atmospheric conditions were of such that the snow fell on the power lines, and it basically created a large tube of ice around the power lines that essentially pulled down our entire power network. So we woke up to significant areas of our community being without power and at the end of blocked roads. And SSEN didn't have the resources on the island to immediately start to address this. We had to work to figure out what had happened. It looked like a normal snow-related, winter-related power outage initially, and it wasn't until kind of well into the day one of the response that we realized that it was incredibly significant and it was affecting large areas of our community. The power outage also resulted in total digital comms outage. So not only were we completely without power and not really sure what was happening with vulnerable people in those communities, but we were completely without ways of contacting them. We had no phone lines, they had no internet, we were completely dark. We had a test run of this earlier in 2022 when a cable was cut and we lost full digital phone, internet, everything for about 24 hours in Shetland, and that happened to be the day that Liz Truss got brought in as PM. So we went out with one PM and came back in with another, and it felt a little bit like the apocalypse had just started. So we had some resilience around how do we do comms when all of our comms channels are essentially gone down. But the wash up for that particular winter was really interesting for us as a comms team because it made us start thinking much more about the kind of things that we're going to be discussing today within this session. So there was a scramble for our health partnership and our community resilience partnership around what data do we have on vulnerable people in Shetland? Where are they? Who do we know? Who's on the SSEN priority list for power? Who's on the NHS's list for having, particular conditions that might mean they would need support. And that data sharing wasn't really in place in time for the services to deliver what they needed to deliver on day dot. And there was quite a lot of work that needed to be done very, very quickly for us to be able to find these people, connect our teams up with essentially four-wheel drive vehicles so that they could, our only tactic was to drive to these people and find them and check that they were okay. We've done a small amount of work post-COVID around sort of warm spaces and hubs from the cost of living. But again, I don't think that work was fully embedded into the communities. When the power went down, it wasn't immediately obvious where your community hub might be, where you should go to get support, what you should do. And we'd done a lot of our usual winter comms in terms of, don't go out if the roads are icy, here's our gritting priority routes, etc., etc. But what we hadn't really done anything of was thinking about how to prepare the community for, prolonged power outages, that community resilience side of things from the residents' point of view, and letting them know what we would do and how that we would get in touch and how we would look after them if that eventuality happened. So that was something that we adopted into our future winter plannings, because we realised we have hard baked into a contract with our local radio providers, and terrestrial radio was the only channel that was working. We have a clause in our contract with them which says that in the event of an emergency like this, we can use their channels to broadcast public messaging. We'd forgotten to tell the community that that's what we had. So we were relying on them putting the radio on and having battery powered radios and all of that sort of thing. So there was we realized there were a lot of gaps in the way we were doing things. And naturally we're trying to do this, but the everyday comms still has to go on. Some areas were more active than the others. So we were trying to explain to residents whose power wasn't off, that services would be being used elsewhere and that we might not be as responsive as we would normally do. And we still had all the usual challenges of winter. And for that's things like we have particular focus on drink and substance use and what that means during the really long, dark winter months up here, particularly around festive seasons where socially everyone's expected to go out drinking. So that should be a priority for us. It's something we've identified within our community. There's a strong need to do. But so often we're pulled aside onto these, ferry outages, power outages. Likewise, everyone will be familiar with kind of Christmas and New Year as a super spreader event for the health and social care partnerships. But in Shetland, we decided to extend that for 3 whole months by having fire festivals once a week from January onwards. So our health teams are then struggling against managing that messaging about flu and respiratory viruses and when you should be going to these large events and what should happen if you've got symptoms and managing visiting to the hospital. Quite, we have quite a lot of bits shutdowns of spaces being able to take visitors because the level of respiratory viruses in the community is so high. So that's still going on throughout, and you all know this happens every winter. Weather happens, but life has to continue underneath it. And for us, we're not nailing the balance of work at the moment, which means that these disruptive events take our ability away from focusing on the stuff that's really important. But ultimately, it's the same people that we're thinking about, whether we're thinking about a disruptive event or whether we're thinking about cold and flu, or whether we're thinking about substance use and isolation. We're thinking about members of our community who are vulnerable. We're thinking about members of our community who are maybe isolated, both geographically, socially. We're thinking about members of our community who are financially struggling in terms of benefit uptake, in terms of cost of living, in terms of fuel poverty. And those are all the people that the winter disruption hits the hardest when it does hit. So for us, we're really needing to think more about how do we bake those people into our winter planning, how do we reach those people, and how do we ensure that they have the networks and safety nets in place to support them with catastrophic winter outages like the 2022 power cut or any other deeper snows we've had, or ferry disruptions. But also, how can we then make sure that ongoing messaging around public health, around community resilience, around cost of living, around benefit uptake is just happening seamlessly behind the scenes, that we've got that message out before the power goes off. So yeah, that's probably it for Shetland. The summary is it's windy, the power goes off and the ferries stop running, but we have to keep doing what we're doing, and I think we could probably do that better.